introduce to you a good friend of mine, Pam Kaur. She works with a local IT consultant, but she is also a patient advocate and just a wonderful person. Thank you.
Okay, hello, good afternoon. I hope everyone has enjoyed their lunch. I haven't eaten yet for fear of getting sick on the stage as I'm talking. My nerves are a little bit shot. So firstly, I want to thank Bill for this opportunity to speak to you. As someone mentioned earlier, I do feel not just as a dutiful employee of Blueprint Healthcare IT, but also as a patient, that the patient voice is important. So I'd like to share with you what I've been through over the last 3.5 years. Firstly, let me tell you, I am a multiple sclerosis patient. I was diagnosed June of 2008. So I'm going to bring you back to December 2007. As I was out shopping, and my right leg almost gave out on me, and I was no longer able to walk. Now, I do suffer from anemia, and I have had Bell's palsy before, so the right side of my face had gone completely numb, and I thought to myself, oh no, the Bell's palsy is coming back. Well, I decided to go to my primary care physician and get tested. I had a CAT scan done, and did notice that day that the nurses that day were a little bit nicer to me than usual. And I figured out why a couple days later when my PCP called me to come in. He said it was an emergency. I arrived at my PCP's office and he said to me, Pam, your CAT scan results have come back and we think you have a brain tumor. That was 2008 January. Well, needless to say, I was very frightened, and the thought of a brain tumor, the thought of possibly dying, scared me, scared the living daylight out of me. Another couple months passed, and he referred me to a local hospital and a local neurologist. I went to the neurologist, and he said, well, Pam, I have good news for you. You do not have a brain tumor, and needless to say, I was relieved. He said, instead, you've had 2 silent strokes. At the time, a woman is not supposed to reveal her age, but I'll let you do the math. I was 24 years old. And I thought to myself, how stressed could I possibly be that I've had 2 strokes at 24 years old? Well, further testing, MRIs, CAT scans, blood work, a spinal tap. After lots of testing, lots of money spent, lots of doctor's visits, I was diagnosed with multiple sclerosis. And the first thing I said to the neurologist at the time when I was diagnosed was, what is MS and how do I get rid of it? And he chuckled and he said, well, you can't get rid of it. Unfortunately, there is no cure for MS at this time. He said, you are going to have to do treatment in the form of injections. It was June 2008, and I turned to him and said, oh, no. Give me the pill. I'll take an oral therapy. Well, in June 2008, there was not yet an oral medication for multiple sclerosis. Therapy only came in injection form. So reluctantly, I did start doing injections. And to this day, I'm doing injections every single day. What worried me, though, the most was after going to my neurologist time and time again on 2 separate occasions, I walked into the front desk and was handed a paper medical record. That's not necessarily my concern, but the concern was, as I was handed this paper medical record to review the information and ensure its accuracy, I realized that paper medical record was not mine. Sure, the first and last name matched mine, but it was not my medical record. I gave the paper record back to the woman at the front desk and said to her, I'm sorry, you've given me somebody else's information. She apologized, took the information, and gave me the correct record. Now I thought to myself, okay, this can't happen again. How often does this really happen? Well, a month later, I was back at the neurologist's office, and again, I was given another patient's paper medical record. And now this started to worry me because I'm thinking, well, how many other patients have seen my medical information? Well, 2 months later, I got a bill in the mail, and this bill was from my podiatrist. And the bill was for a month prior. I thought to myself, I haven't been to the podiatrist in nearly a year. Looked at the first and last name, it was all my information, called the podiatrist. They billed me for a date of service for another patient. Another patient had been to the podiatrist with the same first and last name, and they billed my insurance company. And my insurance company, as great as it is, it paid them. And so the podiatrist got paid for a date of service which was never rendered to me, a service that was never rendered to me. So those are just a few of the instances. Now, something happened in January this year. Now, I've been diagnosed for 3.5 years. January of this year, I had another unfortunate incident. And you all are going to think after I tell you this, I must have crossed a black cat at some point over the last couple of years. Well, I did not cross a black cat, but January of this year, my house burned down. Oh, God. Yeah, I know. That's what I said, but I have a bigger house getting rebuilt. Thank God for insurance, right? So my house burned down, and the most unfortunate thing was all the paper medical records that I had collected from the neurologist, from the PCP, from the podiatrist, from my gynecologist, every kind of specialist and doctor you can imagine, all those paper records burned up in my house. So now I am seeing a new neurologist, and again, explaining my situation because that neurologist does not have an EMR. Again, I've been to plenty of doctors having to, again, explain my situation. And don't get me wrong, I thoroughly enjoy talking about myself. I really do. But you know what? It would be nice if I could walk into a doctor's office and have them be able to access my information without me having to drone on and on about what I've been through over the last 3.5 years. So I am now seeing a physician who does have an EMR, thankfully. And what I've noticed, the difference is I'm no longer going into a physician's office and seeing stacks of paper medical records. I am no longer waiting for hours sometimes, and it has happened where 2 to 3 hours I'm waiting for my physician to see me. Now, one thing I do want to note, I've talked to a lot of physicians and they say that EMRs take away from the patient experience, the patient to physician interaction, and I couldn't disagree more. My newest PCP, while she entered all of my information into their EMR, remained engaged, had all of my information right in front of her, and truly treated me like a human being and not just a patient account number. And I would like to, before I leave today, 2 main people I want to thank. I have to thank Colleen Woods. Colleen, you are a warm and passionate person, and you are truly making a difference in the lives of patients. And Philip Byrne, Pam Cathuria, and their team, you are truly making a difference. And it is what we are doing today that is truly going to change the outcomes of patient care. It took me 7 months to get an accurate diagnosis. 7 months of thinking I had a brain tumor, to crying my eyes out, thinking that I was going to die, to thinking I've had 2 silent strokes, to finally getting a proper diagnosis. To now, every time I go to a different physician, I have to collect my paper medical records. And the most recent event I can tell you about is I ended up in an emergency room after having a spinal tap. And in the emergency room, the physicians couldn't figure out what was wrong with me. And that is because the hospital where I was an inpatient some days before was not sharing data with the emergency room. So again, I had to explain my story, and again, I had to beg for somebody to treat me and treat my symptoms, and at the same time, not to brush me off as just another patient, but truly look at me and say, wow, you have hell of a story, and let me treat you and let me give you answers. So I am happy, very happy as a patient that we are going in the direction that we are going in. And again, I encourage every physician that's here, listen to your patient. They are not just a patient number. They are human beings, and at some point we're all patients, whether it's a regular doctor's visit or whether it's something more, or whether it's somebody in your family that has gone through something. we are all patients or caregivers at some point. So I encourage you to speak openly about what you're going through, because somewhere there are people that have their ears open and are willing to listen. Thank you.